Hello, everybody. Welcome back to Care Plus Hub. My name is Alex Ferman. Love to have everybody back. Today's topic for today's conversation, we're having digital health information as one of our guests. We have Brett Clackus here as our Director of Innovations and Technology. Welcome, Brett. So
Alex,
happy to
thanks for
have
having
you.
me. Happy
It's
to be here.
awesome. We love to tell everybody all about DHI, what it entails, how it benefits the patients, how it benefits the providers, what innovative parts of the technology are we bringing to the table, to the industry, and what is it all about? Can you tell us a little more about what is digital health information and what lies behind it?
Absolutely. I think we have a unique story at Digital Health Information that's going to really resonate with people in our community. Everything that we're doing is about helping shift the care that we provide from a reactive approach to a much more proactive approach. And we've pinpointed several distinct KPIs and metrics that our team can manage and track to help that shift occur here. So the first is having a care team that is assigned to a patient that they're going to be following up with weekly. And these touch points are going to come with giving the patient a device to use within their own home. And we're able to collect that data within 30 seconds to a minute of them taking a reading at home, which is an incredible ability to be able to monitor that.
So basically, the agency will understand what diagnosis and what condition the patient has. Based on that, we want to keep that data flowing not only once a month that they see the doctor, like a pulse ox they would put on their finger, and that way DHI will be able to record that data and we receive that data live as it comes from the device as much as it needed for that patient. If they have glucose problems, it will record from that diabetic glucose monitor, or if they have cardiac problems, it will record anything that the blood pressure monitors will be able to do.
Exactly.
What else entiles into
And
that?
with that comes a decrease in hospitalizations and a decrease in exacerbation of issues. So our care team, not only with the communication they're having, but the data that we're able to interpret, we're able to catch those things before they escalate. And now a patient maybe goes in and sees their PCP instead of being hospitalized in 2 weeks. And I don't think I can emphasize the power of that enough, of what that means to a patient, that we can say, we're tracking your medication, we're tracking your heart rate, your blood pressure, and we're seeing some things that maybe are setting off some alarms, and we can help mitigate that risk for the patient. And ultimately, providers are going to be much more happier because their patients are happier.
Of course, in this space, we cover a lot of segments of the industry. We're covering the patient themselves, which is the foundation of it all, for them to be having loss of gaps of care navigation or care data in perspective of it, for us to catch those scenarios where they're at risk in their vitals and be able to communicate that better to their primary care physicians. Because the way I understand, we work hand in hand in their healthcare network or in their healthcare providers. So we don't replace anybody, we enhance everybody else's services.
Exactly, and we're able to provide reporting every month or every quarter to physicians, so they're able to see the data that we're interpreting and what was actioned on. Beyond that, we also have key medical assessments that we're able to do with patients and chart out and graph over time their improvement through those assessments. So, for example, we have a PHQ-9 that we can do with patients periodically, and the increase that we see is dramatic from their initial test of that assessment to their first 3-month and 6-month test of that assessment. And when you combine everything that we're doing at DHI with the devices, with the assessments, with all of the data that our team is able to interpret, it truly is shifting that care from reactive to much more proactive.
So that way, this company fits perfectly in the ecosystem of healthcare navigation throughout the whole patient community of providers, because sometimes it's longer for them to see that specialist, sometimes it's harder for them to communicate with their regular family doctor or their PCP. We fill the gap for that needed communication and needed support for the patient. So as we were discussing earlier, the stress that puts on the family or the family member or the provider, lack of time, lack of resources, we come in as that foundation, that support, that pillar for that patient and that clinical team of providers for that patient.
Absolutely. Countless times we come into a patient and start helping them, and we see that they're seeing multiple specialists along with their PCP, and no one ever is communicating between those groups. And so with all the data that we have, we're also able to make sure that they're all connected and they are all on the same page of the medications that patient is taking and getting prescribed to from multiple providers. If they saw their specialist, what updates does the PCP need to hear about from that visit, and vice versa, and really helping navigate the care that this patient is having to go through, oftentimes on their own.
Where do you see this moving towards? What other devices do you think will come to the forefront of the industry? Or what do you think the future lies into now? More data and more analytics and more support as the market is moving, demographics are moving. What you see the future lays in touch?
Yeah, that's a great question, Alex. And we're really on the forefront of this technology. These aren't the only devices that we have. We have a glucometer. We have an SpO2 device. We have a smart health watch the patient can use. We have a glucometer. We can connect to Dexcom if they have the wearable CGM. There's a lot of solutions right now. And not only the devices, but coupling that with a software that's able to get that data in quickly, ingest it, and put it into graphs in a way that our team is able to analyze and action upon it as needed. So we actually receive alerts. So if a patient takes a reading and it's higher or lower than what it should be for that specific patient's needs, our team receives that alert and is able to contact that patient and determine if there's a concern that we need to follow up with, or if we can mitigate and resolve anything there with that conversation.
How do you see this moving forward with assisting not only the patient themselves and the family members? Because most of the time they are the caregivers. So now they're not so lost if there's an episode that's happening, or there's questions about how to take the medications and how to do a reading, or what stage the loved one is at. But how are we going to improve capabilities of home care agencies, medical providers, MCOs, or even helping out with reporting for other industry leaders in this segment of long-term care at home?
Yeah, I think groups can really see us as the Swiss Army knife of tools. We can come in and provide a lot of different things that would benefit home health, home care, and providers. And then we're going to be able to pull all of that in together. And ultimately what that does is prevents hospitalizations. That's our number one goal, objective with these programs. And if a patient is hospitalized, we can also help decrease that time it takes for them to get back to where they're living a good quality of life.
That is fantastic. Well, welcome aboard. It is exciting to hear that Care Plus Hub is evolving. We are trying to cover a lot of ground from all aspects of the industry, working with providers, working with patients, creating new innovations in the industry. I want to thank you for your time, Brett, and I want to welcome you to the team. And everybody will be seeing a lot more of us as we evolve and new information comes to the forefront. Thank you, everybody, and till next time.
Thank you, Alex. It was a pleasure.
Pleasure.